Another question from one of our viewers. Can someone living with HIV have a healthy pregnancy?
Absolutely. In fact, the in New York State and many other states, all pregnant mothers are required to have an HIV test.
Yeah. Mm-hmm.
And at the time of that test, we will determine if the mother is infected, then we need to give them medication to
Mm-hmm.
prevent the
Mm-hmm.
baby from getting the infection. Most of the infection uh, happens at the time of delivery. However,
Mm-hmm.
once the person is positive and pregnant, we will give them combination of medication mainly to keep their viral load undetectable.
Mm-hmm.
So if their viral load is undetectable at the time of delivery, then they may not need to take any other treatment. They may not need to have a C-section. They can have a regular vaginal
Wow.
delivery
Okay.
if the viral load is undetectable.
Yes.
And at the time of delivery, if the viral load is undetectable, then the baby is not going to come across any HIV virus
Mm-hmm.
at all. But
Excellent.
it's important we keep that viral load undetectable throughout the
Yes.
pregnancy and around the time of delivery.
Yes.
If the viral load is not undetectable at the time of delivery, they have the 076 protocol that can be administered at the time
Mm-hmm.
of delivery, where
Mm-hmm.
they give them IV medication to prevent the HIV, and they may also opt to do a C-section if necessary.
Got it. Okay. And once the baby is born, is there any need to start any kind of treatment on the baby or
Well,
not?
once the baby is born, we treat
Mm-hmm.
them as a post-exposure prophylaxis.
Mm,
It's as
okay.
if somebody was having sex and they have a broken condom,
Yes.
then we
Mm-hmm.
give them medication within the first 2 hours. So
Okay.
those babies that are born to positive mothers, we give
Mm-hmm.
them medication for at least a month to suppress and about any type of infection that may. We know the risk
Just
is not zero, so
right.
we make sure that we take
Prophylaxis.
it down
Yeah.
to the zero.
Okay. And you mentioned something that we didn't talk about before, so I would like some more information on that. You said, let's say if the partner is, I guess, not not undetectable and they're having intercourse